Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as Rivastigmine. Its brand name is Exelon. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. The exact mechanism of action of rivastigmine is currently unknown. However, it's thought that its action is based upon its reversible inhibition of cholinesterase. This would increase the levels of acetylcholine in the central nervous system. In terms of indications for use, rivastigmine is indicated to be used in the treatment of dementia associated with Alzheimer's disease, and it's also used to treat mild to moderate dementia associated with Parkinson's disease. Now, before somebody was to use rivastigmine, there is some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have a hypersensitivity to rivastigmine or carbamate derivatives, as well as any other components in the product. And it would also be contraindicated in patients who have had allergic contact dermatitis reactions when they've tried to use the patch in the past. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid this medication in the elderly population who are suffering from syncope, as when using this medication there's an increased risk of bradycardia. Skin application site reactions may occur, which could turn into contact allergic dermatitis, and you'd want to stop using the medication if this area became wider than the size of the patch. Gastrointestinal side effects with serious outcomes that could result in esophageal rupture or dehydration have occurred. Examples of these could be severe nausea, vomiting, or diarrhea. Increased gastric acid secretion may occur, so we would want to monitor these patients, especially patients who are at an increased risk of developing ulcers. A dosage adjustment may be needed in patients who have mild to moderate hepatic impairment, and seizures may occur due to an increase in cholinergic activity. We would want to use this medication cautiously in patients who have asthma, as well as in patients who have obstructive pulmonary diseases. Patients should be made aware that urinary obstruction may occur, and it should be noted that patients with low body weight, so a weight less than 50 kilograms, would be at an increased risk of experiencing adverse effects. So when somebody is using the patch to treat mild to moderate dementia associated with Alzheimer's disease, they would typically use the 9.5 per 24-hour patch. They would apply this patch once daily, and after about 4 weeks and good tolerability, they can increase the strength to 13.3 milligrams per 24 hours. If somebody is using the rivastigmine patch to treat mild to moderate dementia associated with Parkinson's disease, they can typically start off with 4.6 milligrams per 24 hour strength, and then again after 4 weeks and good tolerability, they can increase the dose to 9.5 milligrams per 24 hours. If needed, they can increase the dose once more, and the maximum dose would be 13.3 milligrams per 24-hour patch. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using rivastigmine, so I'll go over some of those here now. 1 to 6% of patients may notice a decrease in appetite. Diarrhea falls between 5 and 7%. 3 to 12% of patients may experience nausea, and 3 to 10% may experience vomiting. Urinary tract infections may occur in 2 to 10% of patients, and falls may happen in 6 to 12%. More serious side effects would be the development of a seizure, pneumonia, or dehydration. That's all we're going to talk about today with rivastigmine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.